Uh, Hello, everyone. Welcome to the Unstoppable Power Summit. My name is Amy Weber DeRod. I'm a local project consultant in the Twin Cities area, and it's my privilege today to have a conversation with Dr. Desiree Van Bogart from Desired Health Chiropractic. Desiree, how are you doing today?
Oh, wonderful. Thanks, Amy.
Excellent. I'm so glad to see your smile on the screen. And as we're talking about the Unstoppable Power Summit, one of the things we're doing is figuring out who we are, how to claim our confidence, and how to live that boldly going forward. And you help people do that every day, particularly in a physical capacity. And so you have an interesting title to your presentation, Poised for Profits. Can you tell us a little bit about that?
Yes. One of the things that I really like to talk about is posture, and part of posture is going back to poise. And really, what is poise? It's actually, if you look it up, it's a balance or a way of holding yourself in a balanced position. Now, when we think of poise, we often think of like the ballerina or maybe a royal person having really good balance and grace. But really, what it comes down to is how you balance your body, that equilibrium. And there's lots of research out there showing that people make snap decisions based on a person's posture, their poise, if you will, how they walk into a room, how they stand during a speech, whether or not they're approachable in a casual conversation. And studies have actually found that closed off positioning, such as rolled in shoulders, hands in your pockets, maybe crossing your arms, being in this like closed up position actually comes off as being rated as a weaker positioning or maybe less approachable. So poise is really about making sure that you have the proper stance to invite people in. And really what that does for business or in any areas of your life is it's able to allow you to make better connections with people. It allows you to show your true self and your confidence. And really, all when it comes down to it, if you are more confident, you are better at what you do. You're better at presenting yourself to the world.
Oh, I love that. And as I'm listening to you, I'm finding myself needing to relax my shoulders and sit a little taller. So thank you for that reminder. I love it. So you talked about poise and what it is and posture and the importance of it. How do posture and confidence relate on a deeper level?
Yes. So, really, posture is the way you hold yourself. So, if poise is a balanced position, posture is your position. And there's so many things in our life that throw our posture off. Sports when we're young,
Mhm.
a sitting job, sitting in school, our work and our school environments are actually set up very poorly. They're set up to put us in this poor position. It doesn't activate the brain for learning. It doesn't activate the brain for creativity. And so, what it really comes down to with confidence is making sure that our posture is open, putting us in a better state. When we're in this curled up position or we have a forward head position, it actually puts us in a sympathetic state. And what that means is it stimulates your sympathetic nervous system to activate a stress response because it thinks your body thinks you're in danger. So when you curl up like this, or you have a more of a closed positioning, or you're sitting at your desk in a slumped in posture, it actually activates your brain to think that you should either fight, flight, or freeze. And that in turn is the sympathetic nervous system. And when your sympathetic nervous system gets activated, guess what happens? Your cortisol levels shoot through the roof. Your heart rate starts increasing. It's getting you ready to prepare for something. And when you're in that constant state like this, and you're in this constant curled up position, your body actually ends up going into a constant state of stress. So when I talk about posture with my patients and opening up, it's actually opening up a parasympathetic state. And what that's really going to do for you is put you less in this fear response, this stress response, and put you in a more confident positioning. It's going to activate your brain so you can actually think more focused, more creatively, and just be in a better, calmer state. It's really quite amazing what your posture can do to change your state of mind.
I love it. You've given us a lot of things to think about there. And when people talk about standing upright with confidence in your shoulders back, it's so much more than just how they're perceiving you at that first image. So thank you for taking that deeper. Um, because we're um, presenting today to women and to business professionals, a lot of whom have alternative work arrangements and they're in a home office space. What are some tips that we can provide to our people today to help them utilize their home office spaces to facilitate better nervous system health?
Oh yeah, that's a really good question. It really comes down to breaking up bad habits. So, uh, sitting, especially when you're in the home office, it's a trap. It's kind of like the school situation. You're trapped. You feel like, oh, I need to just sit here. There's no one to engage outside. When you're in an office setting, you can get up and go talk to, oh, I gotta go talk to so and so down the hall. But when you're in your especially home environment, you don't have maybe as many of those opportunities. Yeah, you could get up and do laundry and do get some lunch and stuff. But most of the time, people just end up sitting all day. And what happens is our hip flexors get trapped. Our posture starts getting slumpier and slumpier as the day goes on. So, really, it's all about breaking up those bad habits and making sure that we don't compensate because we're in a stagnant position all day. So one of my best recommendations, especially if you have a home office where you're sitting a lot, is every 15 minutes, you actually get up and stretch back, extend back for 15 seconds. It's a very simple thing to do. And oftentimes people will say, well, if I get up every 15 minutes, it's going to break my focus. And really, what we've seen is that it actually stimulates you. Getting up and getting into an extension posture, extending back, opening up your hips. So maybe moving your legs out, stretching out your hip flexors, opening up your arms up and out and reaching up. It actually stimulates blood flow. And when you come back to your computer, you will actually have more focus and more energy. So that's my guideline. 15 seconds every 15 minutes, just break up that sitting position. Same thing if you're in a work environment where you're doing something very repetitive. Maybe you are moving. For example, when I'm working, I'm actually up and moving around. However, I am doing very similar actions throughout my day. So taking 15 seconds every 15 minutes to do something else to break up that repetition is super important. That's how your body is going to break these bad habits and these compensation patterns that we teach it from being in a prolonged position or a prolonged repetitive movement. So that's one of the
Wonderful.
biggest tips that I have. Another thing I wanted to mention is I think I mentioned the school setting where you're kind of trapped in a desk.
Sure.
And research has shown that if we can get our kids up and moving, they engage and they learn so much better. Well, it's not always easy to do. So oftentimes schools will have like these wobble discs, these wobble cushions filled with air, where it's considered active sitting, where you can sit on something and move around. You can engage your hips and your pelvis and move while you're sitting basically in a stationary position. I think adults often have those big exercise balls where you can
Right.
rock side to side. They now make stools where you can kind of lean and rock. I think they're called like wobble stools. Anything to engage the body and not stay in one position is going to be super beneficial, not only for the body, so it's not having compensation patterns, but it's also going to engage the mind and creativity if you can incorporate some sort of movement throughout your day.
I love that idea. Speaking as someone who does work from home and who does sit a lot during the day, your studies have shown if you take a break, you're more productive. I like to think of what you just shared as more of a micro break focus. And now I have a new timer to put on my phone for every 15 minutes throughout the day. So thank you. I love it. Um, Knowing that so many of us who work from home or in office settings have had years of sitting and years of impact on our body, can you talk a little bit about the relationship between posture and chronic pain or stress related illnesses?
Yeah, this one's huge. So this is what I see in my office all the time is people come in with chronic pain Or sometimes they'll come in with a pain that just happened and they'll say, I didn't do anything. I bent over. I slept wrong. But what happens really throughout our life is we have these patterns. Maybe you have an injury, in a youth sport. So, oh, your shoulder just got kind of messed up in some sort of sport. And what happens is over time, you create a movement pattern to avoid that pain. And over the years, what happens is your body is really good at adapting to the movement pattern of least resistance, the movement pattern that's not going to cause you pain. Well, what happens is over time, you start to get wear and tear. It's not the correct biomechanics set up for that shoulder. You actually have altered your structure over time because of that previous injury. And so what happens is the movement pattern is now compensated, and it's really, really hard to break that because the structure of your body is going to adapt to it over time. The body's amazing until one day it just cannot handle it. And so that's when people will start getting these chronic pain syndromes, or they'll wake up and say, oh, why is my shoulder sore? I didn't do anything. It's something that happened throughout time, and your body has actually been holding on to keeping you as healthy as possible until it just needs a little outside help. One of the other things that I see a lot is because we are in a society that causes maybe a lot of pressure and external expectations on us, that chronic stress starts to add up. And when we are in that chronic stress, that sympathetic state for too long, what tends to happen is we get these stress-related illnesses. If you're in that sympathetic state, I did mention that your heart rate tends to go up. That's going to increase your blood pressure. It's going to increase your heart rate, which might cause more things like anxiety disorders, depression, chronic fatigue syndromes. And then that chronic pain aspect. Just being in a chronic state of stress is going to lead to these detrimental physical signs. That's why people will have things like GI disturbances where their gut is just not right. It's because they're in a sympathetic state. And when you're in that state, your body can't heal, your body can't digest properly. And over time, you start getting symptoms like constipation, diarrhea, not being able to process your food. Your cortisol levels have gone up. You start gaining weight, even though you haven't changed your diet or your exercise patterns. Your sleep habits tend to get worse. You can't sleep because you're in this constant state of readiness. You're in this constant state of danger being in that sympathetic state. You're not going to sleep very well. So then, of course, it's a cascading event. You're not going to have as much energy throughout the day. So those are some of the biggest things that having this constant stress on the nervous system really does correlate to those physical symptoms, not only compensation patterns, but the internal parts of you that just doesn't lead to a healthy lifestyle.
So what's going through my head as you're talking about this is, one, how knowledgeable you are. Two, the value of chiropractic in a healthy lifestyle. And number three, how many of us made health or longevity goals back in January, and we need to revisit those a little differently right now. So thank you for helping us bump that up before half the year is gone, right? That's
Yes.
so awesome. So we've talked a little bit about poise, posture, confidence, and how not honoring those in your body can lead to some longer term or some chronic illnesses that you see, and ways to maybe consider reapproaching those for a healthier stance. Right now, we probably are a little anxious because we're all thinking, So is there a way for us to find a calmer, more relaxed state through our posture? So it's something that becomes more natural versus forced, so we're not doing harm in another way.
Yes, and actually that's really important. I think a lot of people will start an exercise program or think, "Oh, I have some pain, discomfort, and I'm going to start this exercise program to help with this pain." And really, what happens is they'll start exercising, and they might actually make the pain worse, Or what usually happens is they cause some other sort of pain. And the reason this is because that compensation pattern that their body has learned, their body is used to, once you start exercising or trying to change that pattern on your own, it sometimes is detrimental because it's going to cause a different movement pattern that your body's not used to. And really, the way that you change this is you can't force yourself to have good posture. I mean, if you're sitting like this and your mom yells at you to sit up straight, you can do it for only a little bit of time. And eventually you're going to start slumping back into your natural positioning because of those compensation patterns. And there's only two ways I know to break up the actual structure if you have adapted to this position. And number one is surgery. If you have a structural issue, you can oftentimes go in there and have it cleaned up, taken care of. Surgery can fix all sorts of things. The problem is once they go in there, you come out and you have a completely different biomechanics, completely different setup and structure from what you were born with. You will never get that back. So even though surgery might be recommended for certain things, just know that it's going to change how your body moves because of what they did. And you have to set up new patterns, new healthy patterns, or you're going to have a cascading event of pain in a different area in the long term. And the second way I know how to change structure is chiropractic. Chiropractic is the only thing that doesn't put anything in you, doesn't take anything out of you. It doesn't do surgery. It doesn't do medications. What it does is it aligns the joints. So if you have a bad compensation, your structure has been altered. We do everything that we possibly can to get everything back into alignment, to get those joints moving in the best possible way that we can. Granted, sometimes you've done too much wear and tear to get it perfect. Our goal is to get it back into the right position. Then we can start breaking up those compensation patterns through exercise, physical therapy, making sure that we keep it and hold it in the best position possible. And that's what I do. That's what I love to do, is get people in the best position possible, break up those bad habits that your body has held on to for many years. And I will tell you, it's not an overnight fix. And that's why chiropractic doesn't work in 1 or 2 sessions. It's really about getting that structure taken care of. In many cases, we can get the pain to settle down in just a few visits, but the patterns are still there. They're still lingering. Sometimes people resolve in 6 to 8 weeks. Sometimes it takes 6 to 8 months, depending on how long you've held those compensation patterns. And really, it's about finding how you can get your body moving in the best possible way, not necessarily completely balanced, but as poised as possible, based on the history of what your body has gone through. And so that's really what I do. And that's really the best way to get perfect posture for your body, is to make sure that the structure is as good as possible, and then make sure you have the appropriate compensation patterns broken up and breaking up those bad habits so that you can move, balance, make sure that your posture is as perfect as it possibly can be to give you just a better overall, healthier, happier life, because that's really what it's all about.
I love it. Thank you so much for sharing your expertise and your wisdom with us today and for being part of the Unstoppable Power Summit. We appreciate you and we look forward to connecting with you in person very soon.
Thank you so much, Amy.
Thank you.